For this next case, we have a CT abdomen pelvis for a 1-year-old female patient presenting with a history of abdominal swelling, fever, and blood tests have revealed a raised AFP. The clinicians are wondering whether there's a hepatic mass. And as we scroll through these images, these are non-contrast images initially, we can see that there is a really irregular appearance of the patient's liver, with the impression of a really very large mass centrally. The mass looks heterogeneous even on these non-contrast images, with central areas of high attenuation concerning for hemorrhage. And we can see within the abdomen that there is also some ascites, particularly here, as we come lower down within the abdomen, as well as a left pleural effusion with a little bit of consolidation within the left lower lobe. Coming across to these post-contrast images, these look like perhaps a late arterial phase. We can see that some areas of the mass have demonstrated enhancement following contrast, and some areas have remained relatively low attenuation, perhaps consistent with a bit of internal necrosis. The mass occupies a very, very large component of the liver, with deposits within the left lobe, the right lobe, and no evidence of extension into the portal vein or hepatic veins. They appear patent. Again, we can see the ascites. Again, we can see the left pleural effusion with some consolidation. I can't see any other abdominal masses. This looks like an isolated mass. The spleen has the typical tiger stripe-like appearance of an arterial phase study. Okay, so let's put something together here. Large mass centered on the liver, involving both hepatic lobes. The mass is heterogeneous in appearance, with areas of intrinsic high attenuation consistent with hemorrhage and areas of non-enhancement suggestive of necrosis. There is no evidence of invasion of the hepatic vascular structures. The portal vein is patent. There is ascites pooling along the right flank. No evidence of any further abdominal mass. The rest of the abdominopelvic organs appear normal. Left pleural effusion with a small amount of consolidation of the left lower lobe. Okay, let's check that. Make a change to this, ascites pooling. Okay, generate our report from this. I've used my CT abdo-pelvis template. Okay, now we can probably do a little bit better for the impression, and let's use RadChat a little bit to help us come up with a differential. Let's ask it. Okay. Yeah, so there is a differential for abdominal or hepatic masses in this age group, and things to consider would be mainly hepatoblastoma and perhaps mesenchymal hamartoma. Infantile hemangioendothelioma is another consideration. Hepatocellular carcinoma, while possible, is not very common in this age group. However, given the findings of a raised AFP, that really points towards hepatoblastoma out of the rest of the differentials, and that's what RadChat has suggested to us. Okay, so with that in mind, let's say in the context of a raised AFP, the most likely diagnosis is so. Okay, and let's finish there.